Welcome to the Health Services Preparedness Training, Part 2. This two-part course is required each school year. The Health Services Preparedness Training on eCampus, which must be completed before this year's mandatory professional learning deadline, is Part 1. The in-person training at your school campus, or This Safe Schools course, is Part 2. The objectives for Part 2 are to increase awareness regarding common medical conditions and their related emergency situations, to increase preparedness for response to a potential medical emergency.
We will review potential health emergencies that may occur in the educational setting so you can be more prepared to assist the person in need. Do you or someone you know suffer from asthma? According to the Asthma and Allergy Foundation of America, about 4.8 million children under the age of 18 have asthma. Don't have asthma yourself? Well, imagine doing all of your breathing through a straw. This is how an asthmatic feels as the airways start to narrow, swell, and produce extra mucus. Recognizing potential triggers is important in preventing an asthma attack. An early recognition of symptoms is important to prevent a delay in treatment. Be sure any student with difficulty breathing is evaluated by the clinic. Don't ignore the complaints. The treatment for an asthma episode is a rescue inhaler that works quickly to open the restricted airway. Students who have a rescue inhaler on campus must have a valid authorization completed by their licensed healthcare provider. Some students may be permitted to self-carry and/or self-administer their rescue inhaler according to their authorization that's reviewed by the school board nurse. The student may have an emergency action plan that should indicate where the inhaler is located. If the student does not show signs of improvement after administration of the rescue inhaler per the authorization's order, 911 should be called for further evaluation. Anaphylaxis is a severe allergic reaction that can be life-threatening. The immune system releases a flood of chemicals, sending the body into shock, causing low blood pressure, constricted airway, and a weak, rapid pulse. Recognizing anaphylaxis is critical for early intervention. An anaphylactic reaction is a systemic reaction that involves multiple organ systems, so think fast. F for face. Look for itching, redness, or swelling of the face and/or tongue. A for airway. Look for trouble breathing, swallowing, or talking. S for stomach. Look for vomiting or diarrhea or complaints of abdominal pain. And T for total body. Look for overall paleness or loss of consciousness. Look for rashes, redness, or swelling on other parts of the body besides the face. It is important to know that any time the lips, tongue, or airway are affected, or two separate organ systems are affected, for example, the student has hives on their arms and then begins to vomit, we need to administer emergency medication if available and call 911 immediately. Anaphylaxis must be treated immediately. The drug used to treat anaphylaxis is epinephrine, sometimes called epi. It works within minutes to prevent progression, but does not reverse anaphylaxis. Therefore, emergency medical services and parent or guardian will always need to be called. Epinephrine is administered through an autoinjector into the large muscle of the outer thigh. Shown here are the types of epinephrine autoinjectors you might see for your students. They are all a little bit different, but all deliver the drug epinephrine. You may want to familiarize yourself with the specific type that your students have prescribed to be as comfortable as possible with using if necessary. Remember that the administration instructions are always on the autoinjector itself in case you need reminders. And when in doubt, give it. Epinephrine is a hormone that is naturally in the body, and one of the biggest mistakes made with anaphylaxis is not giving the epi. Next, we'll review seizures and epilepsy. A seizure is a sudden, uncontrolled electrical disturbance in the brain. It can cause changes in behavior, movements or feelings, and in levels of consciousness. If you have two or more seizures or a tendency to have recurrent seizures, it's considered epilepsy. It is important to understand that there are many types of seizures ranging in severity and may look different from person to person. You are not expected to know each type, but we want you to have a basic understanding that seizure activity can range from brief moments of blank staring to total loss of body control. Among the different types of seizures, the type that requires an emergency response is typically the convulsive, tonic-clonic, or grand mal type. These can be scary to experience, but try not to panic. Shown here are the stages of a grand mal and what you might see during each stage. The most important thing to remember for this type is to follow the seizure first aid steps. Seizure first aid may need to be a group effort. We want to help the student onto his or her side on the ground while protecting their head. It is important to note the time any seizure starts and monitor the length of the seizure. Someone needs to call for help. Be sure whoever calls shares the name of the student and the location of the event clearly. Other students should be escorted out of the room or area to provide privacy, and be sure to discourage any videoing or photography. Try to note the description of the seizure, what you see, so you can share with the clinic staff, parent, or emergency medical services. If there is a student in your class with a known seizure disorder, they should have an individualized plan for treatment and may have a rescue medication at school. There are several types of seizure rescue medications. The steps for administering the rescue med would be reviewed with you in person by a school board nurse according to the student's individualized plan. The period of time to administer any of these medications is determined by the student's physician. Because the doctor writes specific orders as to when the medication is to be given, we need to know when the seizure activity starts. This makes your role very important in the classroom. As soon as seizure activity starts, the time needs to be noted and tracked so it can be determined if and when the medication can be given. Seizure activity is generally a 911 call, but this may differ student to student. So please familiarize yourself with each of your students' emergency action plans or speak with your clinic or school board nurse for more specifics. Let's move on to diabetes, a chronic health condition that affects how the body turns food into energy. Insulin is a hormone normally made in the body. It helps glucose or sugar enter cells where it can be used for energy. Without insulin, glucose remains in the bloodstream and cannot be used for energy by the cells. When the glucose is in the bloodstream, it can be detected and measured, which is how diabetics monitor their levels. There are two common types of diabetes that you may see in the schools. Type 1 is an autoimmune disorder that attacks the pancreatic cells, preventing the body from making insulin. This patient must take insulin based on their blood glucose level to survive. Type 2 is when the body does not respond or use the insulin properly. This type is normally acquired later in life as a result of lifestyle choices such as diet or exercise. Their treatments can vary, but also may include taking insulin. The most important thing to understand regarding diabetic care is recognizing the difference in treatments for high versus low blood glucose levels. If there is a student in your class with diabetes, they should have an individualized plan for treatment. You will be working with your school board nurse to learn the ins and outs on how to help this student manage their diabetes while at school. But understand that high blood glucose levels can be dangerous. It can damage things like blood vessels, kidneys, and eyesight over time. But low blood glucose can be deadly if not treated immediately. Low blood sugar always requires immediate action. Signs, symptoms, and treatment steps should be followed according to the student's individualized plan. If you suspect low blood sugar, call for help. Do not send them to the clinic. Have the clinic come to you and be sure to stay with the student. Have you ever witnessed someone choking? How do you know they are in fact choking? Choking is when a person can't speak, cough, or breathe because something is blocking or obstructing the airway. Once you have confirmed they are choking and have offered to help, you can perform the Heimlich maneuver to dislodge the object. To perform the maneuver, you would stand behind the person, placing one foot in front of the other for your balance. Make a fist with one hand. Place the thumb side of the fist just above the navel or belly button. Grasp the fist with the other hand. Perform abdominal thrusts in an upward motion until the item becomes dislodged or the person becomes unconscious. Be sure to use a scooping motion, as the goal is to essentially knock the air from the lungs, forcing the object out. When performing the Heimlich maneuver, there are only two options. Either the item becomes dislodged and it comes up, or the person becomes unconscious and goes down. If the person goes down, you want to safely lower them to the ground and begin chest compressions. Anytime the Heimlich is performed, 911 should be called immediately. If the Heimlich is successful and the object comes up, the person needs to be evaluated, as the Heimlich requires force and may cause trauma. If the Heimlich was unsuccessful, the person will go down and will require emergency medical services as you begin chest compressions. Can you perform the Heimlich on a pregnant person? Yes. You would perform inward thrusts in the center of the chest. Can you perform the Heimlich on someone physically larger than you? Yes. You can ask them to lie down, straddle over them, and perform the same upward thrusts above the belly button, or perform chest thrusts as you would the pregnant person. Or if you're unable, you would wait for them to go down and begin chest compressions. Anytime a person becomes unresponsive and is not breathing, chest compressions will need to be performed and an AED will need to be retrieved. Direct someone to get the closest AED. Position yourself to the person's side near their chest. Place the heel of your hand on the center of the person's chest. Place the palm of your other hand on top. With your shoulders over your hands, press down hard, 5 to 6 centimeters or 2 to 2.5 inches at a steady rate of 100 to 120 compressions a minute. Continue with chest compressions until the person begins breathing on their own or until EMS arrives and takes over. Anytime you initiate CPR, you have to be sure someone is getting the AED, or automated external defibrillator. It is important to know where the AEDs are located on your campus in case you are asked to retrieve one. Any person capable of turning the AED on and following the prompts can effectively use one. There are different types of AEDs on our campuses and in the public setting, but all are designed to direct the rescuer step by step. Once you turn an AED on, it will tell you exactly what to do and will repeat itself until the action is performed. Continue the cycle of chest compressions and AED use until the person becomes responsive or EMS arrives and takes over. Opioid drugs include prescription pain medicine and illegal drugs. Examples of opioids include morphine, heroin, codeine, oxycodone, hydrocodone, and fentanyl. Symptoms of opioid use include drowsiness, euphoria, slowed breathing, confusion, constipation, nausea, and vomiting. Opioids can restrict the ability to breathe when taken at a higher dose or when misused. This can lead to a fatal overdose. Naloxone or Narcan is a medication that rapidly reverses an opioid overdose. The school resource officer or deputy on each campus carries naloxone and is trained to administer. Call 911 immediately for any suspected opioid overdose. And if you see evidence of drug use or suspect an overdose, Always put a barrier between yourself and potential exposure.
This completes part 2 of the Health Services Preparedness Training. Please know that you can contact your school's assigned school board nurse anytime for additional training, questions, or concerns you may have now or throughout the school year. The next step is to pass the knowledge check with an 80% or higher to complete this course. Thank you.